1 second. Hey guys, we're going to get started. If you want to just give us 1 second, we're just going to go ahead and embed the video, and then we'll get started in 1 minute. So let's see here. Okay, hold on. Okay. Okay. There we go. All right, guys. Sorry about that. We had some technical difficulties. I noticed that the stream was not loading in our community, but we should be all good now. Hi, everyone. Welcome to our office hours. I am here with the one and only Mary Shomon. My name is Alex Ruiz. I am the Director of Content Community here at Paloma Health. In case you guys don't know who we are an online medical practice that specializes in treating Hashimoto's and hypothyroidism. So all of the patients that we see virtually from the comfort of your own home. And we even offer test kits. We have a really great mobile app that has plenty of resources from blogs, meditations, guides, workouts. We have recipes. We have courses. We have capabilities such as symptom tracking, for example, that you can all do from the mobile app. So without further ado, I'll go ahead and let Mary Shomon take it away and answer all of your questions for today's event.
Terrific. Thank you, Alex. I'm really excited to be here and really thrilled to be talking with everyone. We're getting close to the holidays, so I know everyone's getting super busy, but I'm glad to have people taking time out to hear a little bit more and learn a little bit more. Just a reminder, I am not a practitioner. I am a patient advocate and educator. So my job is to fast forward you up the learning curve and give you ideas on options to pursue with your doctors and how to get your information out. So let's go ahead and jump into the first question. Alex, the question sort of appeared and disappeared. So it was related to T3. Can you possibly read that one to me?
Go ahead and open your chat and you should be able to read it.
Oh, got it. Thank you. See, I'm just still needing technical help here. Okay, we're all set. Okay, so why should I add reverse T3 to my test if we don't know what it does? So this is an interesting question because the Paloma test kit, which tests for TSH, free T4, free T3, and thyroid peroxidase antibodies, you have the option to add on a reverse T3 test when you're checking out and buying one of those test kits. You also have the option to add a reverse T3 when you're getting blood work done at your doctor or your lab. So the idea that we don't know what reverse T3 does, we actually do, because reverse T3 is an inactive, useless, and blocking form of T3. And T3 is the active thyroid hormone at the cellular level. That is the hormone that goes to those cells and helps the oxygen and energy get through the barrier and into the cell. Well, I've heard people explain what reverse T3 is in various ways, but one of the best explanations I've heard is that it's kind of like if you have two fitted gloves. You have a right-hand glove and a left-hand glove, and if you put them next to each other, they look pretty much the same, right? They both are gloves and they look very similar. But if you try to put your hands in, they're not quite going to fit because they're set up for the right hand and the left hand. Well, it's the same with reverse T3. It's shaped exactly like regular T3, but when it tries to get into the cell receptors for helping that oxygen and energy get in, it fits in, but it doesn't open the door. It's like a key that won't open the lock. So when we test for reverse T3, we're looking to see what level of this type of T3, this useless inactive form of T3, do we have floating around in our bloodstream. And if that level is very high, that can be an indicator that you might benefit from a combination therapy, T4 and T3, or a natural desiccated thyroid drug, rather than a T4 or levothyroxine only hypothyroidism treatment. So there's a benefit to testing for that reverse T3 in helping make that decision. And the other benefit of testing for reverse T3 is it also is identifying when your body is under stress, because the body makes more reverse T3 when it's under physical, emotional, life stress. So if your reverse T3 is kind of sky high, it also tells us that we need to look for what types of stressors is your body under. Are there chronic infections? Do you have nutritional deficiencies? Is there a lack of sleep? Are you having a stressed out life? You're not practicing any kind of stress management. So it's another marker to give us more information to help you live a healthier lifestyle. Okay, our next question. My thyroid hormone levels are normal, but I have a goiter. Let's see. How can I get rid of it? I'm taking the daily thyroid supplement, which has tyrosine. Will that help get rid of my goiter? Are there things I can do to get rid of the goiter naturally? Okay, so let's explain first what goiter is. Goiter is an enlarged thyroid. It's essentially just the term for an enlarged thyroid. It's different than a thyroid nodule or a lump or bump on the thyroid. Goiter is simply the enlargement of the thyroid. And goiter can take place when you have Hashimoto's. It can take place in Graves' disease. And one of the characteristic signs of, or one of the characteristic symptoms of, or triggers, I'm trying to think of triggers of goiter. Goiter is the symptom of an iodine deficiency or an iodine excess. So one of the things that you can do when you have goiter is to get your iodine levels checked. Usually that's done with an iodine loading urinary test. And that will give us a good picture of what's going on with your iodine levels, because if you're over or under replaced with iodine, that may be contributing to goiter. In some cases, if your antibodies are very high, like your thyroid peroxidase antibodies, one of the markers that we test for in our test kit, that can also cause inflammation in the gland that causes that enlargement, that causes that goiter. Now, nutritional things to support the thyroid, like the Paloma Thyroid Health Vitamin, which includes the tyrosine and zinc and a variety of other nutrients, they can be helpful, but they're not necessarily going to get rid of goiter. The best way to approach it is to look at trying to get the antibodies down so that the inflammation of the gland gets smaller. Also to look at making sure you're getting that good nutrition, the good thyroid nutrition, like through a vitamin, and getting as much of these nutrients as are recommended. And another issue would be to, if you're borderline subclinical hypothyroid and not being treated, there are many doctors who will make the decision to go ahead and treat you for subclinical or borderline hypothyroidism, because that can oftentimes help shrink the goiter. There are situations, however, where goiter does not shrink. And if that's the case, then the question is it cosmetically unsightly? Is it so visible that you want to get rid of it? And in that case, sometimes there are other treatments that might be done for a goiter. And then there are situations that are considered more of an emergency. If the goiter is interfering with your ability to breathe or swallow, then typically your doctor would recommend surgery to remove all or part of your thyroid in order to clear your airway and make sure you can breathe and swallow correctly. So taking good care of the thyroid overall is going to support thyroid health and reduce the chance of goiter and perhaps help it. But there aren't a lot of sort of instant remedies to let's shrink the goiter and get back to normal. Takes some time, and you have to work with a knowledgeable practitioner to look at some things that may help get that goiter down in size. Okay, we have another question. I have Hashimoto's and I've had gut and bathroom issues for over 15 years, along with other common symptoms, fatigue, brain fog, depression, etc. I follow a very strict gluten, dairy-free diet. I've done elimination diets. I eat healthy whole foods and rarely eat in restaurants, and nothing seems to work. any words of wisdom on diet would be appreciated. This is an interesting question. I'm not completely sure if the main problem here is gut and bathroom issues, but that's what it sounds like. It wasn't necessarily weight loss or antibodies issues. It seems to be more about dealing with the gut and having digestive problems. In this situation, I mean, this may have something to do with thyroid, but this is one of those examples where we have to be a little bit careful about assuming that everything that we have symptomatically is driven by a thyroid condition. This person could have sort of a chronic bacterial dysbiosis, an imbalance of bacteria in their stomach. Even though they're doing all of these really amazing things, if you have an imbalance in your gut bacteria, which some of us can carry for decades, this is going to create a variety of gut problems, can cause leaky gut types of symptoms. You can feel irritable bowel syndrome. You may have alternating constipation, diarrhea, loose stools, stomach upset, feelings of nausea, bloating, variety of digestive issues that are indicative of some sort of underlying gastrointestinal issue. Also, keep in mind when you have Hashimoto's and hypothyroidism, you're at higher risk for suspicion of celiac disease, because celiac disease is much more common in autoimmune patients. So we would want to maybe take a look at, does this have anything to do? Now, she's saying she follows, or he, a very strict gluten and dairy-free diet. So I'm going to assume it's probably not a celiac condition. But in some cases, if this was discovered late in life, and the gluten-free diet was late in life, we may be looking at somebody that had long-standing celiac with some damage to the gastrointestinal system. So as always, with everything thyroid, we make sure the thyroid treatment is optimal. So we want to be at optimal levels, optimal thyroid replacement, and really feel our very, very, very best from the thyroid standpoint. And then when we still have continuing symptoms from that standpoint, then we may need to look to other causes and other potential triggers. All right, what are the guidelines and frequency for thyroid medication adjustment during pregnancy, and how frequently to repeat thyroid labs? Okay, so when you're pregnant, there's a different reference range. It's a much narrower and lower reference range. I don't have the numbers off the top of my head, but we have a chart at the website in an article about that, showing what the different levels are supposed to be first, second, and third trimester. But they tend to be a lot lower than the general reference range. So I think it's like a 2.5 and lower. But don't take my word for it. We need to look that up, and we can probably put that into the chat as well. But the issue here is we need to keep a lower TSH because we're trying to provide enough thyroid hormone for the developing baby, especially in that first trimester, because baby's thyroid is developing during first trimester, but it doesn't come online and start producing thyroid hormone for the developing baby until the second trimester starts. So about 13, 14 weeks. So that first trimester, which is so important for neurological development, the baby's entire body is relying on the mother's thyroid supply. So it's very important when you first confirm your pregnancy to get your thyroid checked, because most women need at least a 50% increase in their dosage in thyroid medication within the first trimester in order to accommodate the additional needs of the baby. I believe the guidelines say that you should be tested every trimester thereafter. But I can tell you, as somebody who got pregnant with Hashimoto's and hypothyroidism, I erred on the side of caution. I tested immediately upon confirming my pregnancy. And my piece of advice is test frequently at home, and don't wait to confirm your pregnancy until you've missed a period. If you're trying for a baby, start checking right away. Because as soon as you can confirm, you can either get your thyroid tested, or you can have a plan in place with your doctor to immediately increase your dosage. Many doctors will have that plan in place with a woman who is trying to conceive. I checked at least twice a trimester because I was wanting to keep very, very on top of my levels. I know other women that have done that as well. That's where the thyroid test kit comes in handy, because you can test as often as you want and it's affordable. But at least once a trimester, And definitely that first trimester, when you first confirm the pregnancy, you want to definitely be checking it to make sure that it's staying where it needs to be in the lower end of that pregnancy reference range. And don't ever let anybody tell you you're being neurotic or you're testing too often, because when it comes to ensuring that you have a healthy baby and a healthy pregnancy, I don't think there's anything that's neurotic about that. If it is, I'm neurotic too, because I did that and I had a healthy baby. Okay, let's see. What do we have here? I found a functional medicine, NP. We're combining HRT with T3 and T4, but my hair is still falling out. My nails are thin, short, broken. My skin is breaking out. Weston Childs has a name for this condition called thyroid or something like that. When a person has maximum thyroid and hormone support, why would their thyroid still not balance? Before I went back on T3, my T3 was too low. Okay, so this person's got a complicated situation, but here's the thing. If they are taking HRT, hormone replacement therapy, my guess is they're perimenopausal or into the early stages of menopause, and they're taking T3 and T4. So one of the things we need to talk about is how when your hair is falling out and nails are not strong and skin is acting up, these can all be signs of things related to your hormones. And so one of the things that I would want to check in this situation is, where are those different hormones looking like? Is the estrogen decent? Is the progesterone okay? Testosterone, is it too high, too low? Do we have a high level of dihydrotestosterone, DHT, which helps trigger more hair loss? Have we changed any medications lately? Because that can also trigger some hair loss. Did the person have COVID 6 months ago? Because COVID and other viral infections, a couple months later, we can often see a big shed of hair. So the issue here is, I'm not 100% certain that everything is due to the thyroid, because with hair, it operates very slowly. And so you'll see shifts and changes, etc. One of the things that I've done, because, I've gone through periods of hair loss at times, but now at 62, I've got a pretty decent head of hair. Good hair vitamin, collagen, because I do not take any HRT. I don't take estrogen, but I take collagen, which I find really helps with my skin and my hair and my nails. Usually in a couple of weeks, I can start telling it's working, primarily because my nails get stronger. But then within about a month or two, you start to notice some baby hairs growing around your hairline. So collagen, a good hair vitamin, a healthy diet, which includes enough protein, because protein is really important in order to maintain and keep your hair healthy. And making sure that the thyroid medicine is good. One of the things that people don't always realize is some of the ingredients in the thyroid medicines may be allergens or sensitivities. For me, when I was on Synthroid, I lost a lot of hair, but I'm also allergic to acacia and to lactose, both of which are in Synthroid pills. So once I switched off the Synthroid, got on a T4, T3 combination therapy, and switched up and added some more vitamins and supplements and things, my hair came back. But you got to be patient with hair. It takes time. All right, next question. I have Hashimoto's, and I have been on compounded porcine thyroid meds for a while. I seem to remember recently reading that desiccated thyroid is not necessarily great for those with Hashimoto's. Okay, so compounded porcine thyroid is basically a compounded version of natural desiccated thyroid, like Armour Thyroid, MP Thyroid, and the old Westroid, WP Thyroid, and Nature Thyroid. These are thyroid drugs that are made from the thyroid glands of pigs. That's why they call them porcine thyroid. They are the form of thyroid medication that was the first to the market about 100 and some years ago, probably about 120 years ago now. And they have been around for over a century and are still in use today. A lot of people are still using desiccated thyroid drugs and prefer them for their thyroid treatment. In some cases, people get a very custom dose, or they want custom fillers. In that case, they're getting it compounded, which is meaning that they're specially putting these capsules together at a specialized dose for this particular patient. It's not coming in a bottle to a pharmacy from a manufacturer. It's being custom produced for that patient. Occasionally, you will see information that says that thyroid patients with autoimmune Hashimoto's shouldn't take natural desiccated thyroid. And I've asked a number of holistic and integrative doctors, is that really true? And they said, we really don't see much problems with patients who have autoimmune thyroid taking natural desiccated thyroid unless they have a sensitivity to the ingredients in the tablets or to the porcine component. Some people have a pork allergy. So there's a small subset of people who react poorly to it, and it's just not the right drug for them. But the vast majority of people don't seem to have a problem with it. I think there were concerns because because it's derived from animals and not synthetic, that it may be perceived as an antigen by the body or as a foreign invader, and that the immune system would then get activated and get all revved up. But every single doctor I talked to has said to me, you know what, the best thyroid medicine is the one that works best for my patients. And if that's natural thyroid, if it's Synthroid, if it's Levoxyl, if it's a generic levothyroxine plus a T3 or a compounded med, that's what I'm going to go with. So I've never heard that the doctors who do this day in and day out don't have a hard and fast rule about avoiding natural thyroid for patients with Hashimoto's. Okay, our next question. What are your thoughts on iodine and low versus higher dosing? I've gone from one doctor saying I was iodine deficient with urine testing to prove it, another one telling me to stop taking it because I had Hashimoto's. I believe my health has been affected from not taking iodine, and I need to get back on it, but I'm not even sure what dose or type is appropriate. Okay, this is a pretty common question because most of us that are involved in thyroid health and thyroid patients, we all know iodine is sort of one of the key nutrients that we have to be aware of, because the thyroid gland uses iodine, the raw material of iodine, to make thyroid hormone. So we absolutely have to have iodine in our diet from our food or from supplements or both in order to produce enough active thyroid hormone. So the question here, though, is because there are some holistic and alternative and naturopathic doctors and also store clerks at vitamin stores and things who basically hear the word thyroid and immediately they say iodine, iodine. And it's a little bit the idea is, oh, if there's some is good, more is better. And this is where we get into trouble. Iodine, I sometimes jokingly refer to it as the Goldilocks nutrient, because you don't want too much, you don't want too little, you want just the right amount for you. And how do you know what that is? Well, it's first of all, you can do the testing like this patient did, which is to go ahead and get a urinary iodine clearance test to find out if you are looking at a deficiency of iodine. And for a couple of decades, we haven't had very high iodine deficiency rates in the United States because of iodized salt. But we're all getting healthier. We don't need as many processed foods with iodized salt. And then there's people like me and a lot of you. I don't like regular salt now anymore. I want the Himalayan pink salt, and I want the Celtic sea salt and all the special, wonderful, delicious salts. They don't have iodine in them. And so a lot of us are getting to a point where we're starting to see a resurgence of iodine deficiency, especially in women of reproductive age, which is when it is the worst to have a low iodine level, because that is essential, again, for baby's health and for mom's health and her fertility as well. But we're seeing just across the board higher numbers. It's not endemic, it's not everywhere, but much higher numbers than we did in past decades of people that are borderline or low on their iodine. So the first rule with iodine, don't just start taking iodine without testing, because if you add iodine in and you're not deficient, then the doctors who say, oh, you have Hashimoto's, don't take it, they're actually right, because you don't want to put fuel on the fire. If you are replete with iodine, you have enough iodine in your system, and you start taking extra iodine, that can create goiter, and it can cause inflammation in your thyroid gland, and it can make your symptoms worse, and it can affect your thyroid levels and thyroid function. Similarly, if you have way too low iodine, it can also cause goiter, and it can create more worsening hypothyroidism, providing less thyroid hormone to your body. So both ends of the spectrum are problematic. That's where the testing comes in. And then once you establish that you, in fact, do need iodine, there's two forms that most of the doctors will recommend. And it's either an iodoral, which is a combination of iodine and iodide combinations that the body absorbs best. That's in a tablet form, or Lugol's solution, which is a liquid iodine combination that is also, again, the two together in one liquid. So you take it as drops. The dosage, that's something you're going to have to work out with your doctor, your nutritionist, or your holistic expert, because you'll see everything from recommendations of very small 400 micrograms, 1 milligram maximum types of things, doses, up to some doctors online recommending 10, 15, 20 milligrams of iodine. And but I would say be very careful about very high doses of iodine, because again, it's very easy to get yourself into a place where you have way too much in your system, and work with someone who knows what they're doing when it comes to iodine therapy, to using iodine as a nutritional supplementation. I can tell you myself, I cannot do supplemental iodine. I have Hashimoto's, I'm hypothyroid. I'm a little bit iodine deficient according to the test, because I've had the test done, but I've tried to take the iodine tablets. I've tried to take the Lugol solution, and every time, even if I take the smallest dose, my thyroid blows up like a balloon and I'm flat on the couch for a couple of days. So what I have found is I do much better with it in the food. So I use a little bit of iodized salt. I get that. And even if it's not as tasty as the others, I'll use a little bit of that. And when I start to feel like I actually start to crave iodine, sometimes I can tell, that's when I go, and that's sushi takeout day, because I get some seaweed, I get some seaweed salad, I get some sushi. And honestly, I feel great. And I've checked my iodine levels like a week or two after I've done my sushi dinner, and my iodine levels get good. So I think because I'm borderline, just eating foods that have some extra iodine is enough to kind of push me over into the right range. And I've gotten to the point where I can tell when I need it. So be very careful with iodine, but don't ignore the possibility that you may need it, but don't go on anything other than test results to tell you, yeah, you definitely need iodine. Other than that, a recommended daily requirement of iodine, which I think is about 200 to 400 micrograms, is perfectly safe for most everybody. That's what you typically find in a multivitamin tablet or capsule. All right, let's see. Next question is, for those with postmenopause, weight gain, and a total thyroidectomy, will the new class of weight loss drugs help me shed the extra pounds? And I'm not sure about the new class. I guess we're talking about maybe the GLPs, the Ozempic drugs. That seems to be the most hot topic these days. Those drugs are working on the insulin relationship and the body's ability to process where it stores and saves and burns sugar and fats. So, I mean, I'm seeing a lot of people having very good results with the GLP drugs. They do have, for some people, side effects. They can cause some nausea, diarrhea, vomiting, etc. But a lot of people have no side effects, or very few. And some people just jump right in and do very well with them. People do lose weight with those, but it's not maintainable without staying on the medication all the time. So the question there is that a viable option? They also tend to be extremely expensive and not always covered by insurance. But postmenopause, total thyroidectomy, the key here is also making sure that the thyroid is optimally treated. We want to make sure that thyroid is not just, plugging along in the high normal range or borderline subclinical hypothyroid. We want to make sure it's really optimal, it's tuned up and ready to go. We want to look at diet and making sure that we're focusing in on some techniques like going with a sufficient amounts of protein and maybe intermittent fasting, which help to reset and rev that metabolism back up, because that's what a lot of what's going on in the menopause and postmenopausal transition is that the metabolism has slowed down and shifted, and some of our fat cells have migrated from the buttocks and the hip area up into the belly, where they become extremely effective at saving and storing fat. So we want to do whatever we can to build some muscle, increase our protein intake, shift that metabolism around. And that's something that our Paloma nutritionists and Paloma Health coaches can also work with you on to help you sort of map out a strategic plan of action for this. All right. And then we have let's see, it looks like one of our last questions, basal temperatures. Please speak about that. I'm not trying to conceive, but I got a basal body temperature thermometer. My my levels are normal, lower when I'm feeling well, but when I'm sick, I can't even get it to display a temperature high enough. Nobody believes I have a fever. Sometimes I feel sick when my temperature is 98. Have I seen this anywhere? What's interesting is the relationship between basal body temperature and thyroid. And basal body temperature is a loose measure of metabolism. It's not a complete measure of metabolism, and it's not a measurement of thyroid function. It is one marker that can tell us a little bit about what's going on in the body. But I can tell you that there are going to be people who will always run hot who are hypothyroid. There are people that have cold, low body temperatures who are hyperthyroid. So there's no hard and fast rule that everyone who's hypo is going to have a low body temperature and everyone who's hyper is going to have a high temperature. I don't follow that rule. I know a lot of other people that don't. That said, there are some people who are very sensitive to fluctuations in their thyroid hormone because thyroid hormone helps the body maintain thermogenesis, the process of burning off fuel to maintain body temperature. And so when we're looking at someone that has a consistently very low body temperature, that can be a sign of hypothyroidism. But that's when we have to be looking at our biomarkers, our tests, our TSH, our free T4, our free T3 to see where those levels really are. Because that is going to be the measurement of free T4 and free T3, the actual circulating thyroid hormones in our cells, is going to be a much more accurate picture of what's going on in our thyroid than a basal body temperature measurement. So we can use that to kind of get a broad picture of, oh, this is something we need to look at. But at the same time, it's not diagnostic for thyroid patients. So if you want to check your temperature, it's helpful. A lot of women do it when they're trying to conceive. I know some people that do it to see if their body is responding to a dosage increase, and even tiny fractional increases in their body temperature on a baseline level every morning can indicate that their body is responding to their thyroid meds. So you can use it in that way, but don't rely on it as if it is a definitive piece of information about your thyroid function, because it's not. It's one piece of a much bigger pie of various factors that have to come together for your thyroid to work well. Okay, looks like we have one more question, and then we're going to wrap things up. Last question: when does subclinical hyperthyroidism, low TSH, and normal free T4 with symptoms warrant treatment? Well, that really depends on you and your doctor. When it is subclinical, the doctors are going to be looking at the factors that are going to be the most risk. So is your pulse very elevated because of the hyperthyroidism? Is your blood pressure elevated? Are you having insomnia? Are you having anxiety, panic attacks, constant chronic diarrhea? Is your body temperature elevated to the point that you're hot and sweating all the time? Do you just feel absolutely miserable? Because part of the decision on borderline thyroid cases is symptomatic, and part of it is safety. So if a patient has a ragingly high heart rate, even if they're subclinically hyperthyroid and their levels are sort of on the line, if your heart rate is high, your blood pressure is high, your doctor is probably going to go ahead and significantly recommend treatment and say, because we don't want your heart rate to be this high all the time. We don't want you to have a high blood pressure episode from this. And we don't want this to, it's not very common, but in rare cases, untreated hyperthyroidism can trigger something called thyroid storm, which can be extremely dangerous and cause a heart attack or stroke. So most doctors are going to err on the side of caution. And if you have any clinical signs that are questionable, like that high heart rate or that high blood pressure, they're going to recommend treatment. Conversely, if you're on the borderline and the doctor's thinking, well, it's one way or the other, but you feel sick, you feel miserable, you can't sleep, you're anxious, maybe your heart isn't that elevated or you don't have those symptoms, but you have diarrhea and you're anxious and you're having insomnia and you just don't feel when you're hot all the time, your doctor may also say, you know what, I think we're going to give you a treatment. We're going to be conservative about it. We're not going to go all in, but we're going to give you some treatment to make you more comfortable. So this is one of those, it depends on the situation. Obviously, if somebody is profoundly hyperthyroid, almost every doctor I know would say, let's get started treating them yesterday, because they do not want you to go into thyroid storm or atrial fibrillation or the other side effects and issues that can develop when hyperthyroidism isn't treated. But when someone is on the borderline and it's not their health and life is not in immediate risk, they have a little bit of time to think about it. They may have options one way or the other, but again, very symptomatic on a borderline, doctor's probably going to be willing to treat you, and very clinically evident issues with heart and breathing and blood pressure, doctor's probably going to say you should be treated. So those are all the questions that we had today. And I love answering them. I feel like I'm on Jeopardy or something. It's really fun. So thanks to everyone who sent in these great questions. And I hope that we covered the things that you wanted to get to. And I also will point you to our incredible library of blog and articles, because we have so many topics covered, and many of these things are discussed in much greater detail in full articles that you can also go back to for reference as well.
Yeah, thanks, Mary. Guys, if we didn't get to your question, absolutely, we 100% recommend that you either go to the mobile app, which has all of our blogs, or go to our website. A lot of this information as far as lab ranges, values, symptoms that you could be experiencing, maybe treatment plan options that you can present to your doctor or at least discuss with your doctor, are all resources that we have available both on the blog. We have a whole learn section that also has guides as well that you can download and refer to. So without further ado, again, thank you, Mary, so much for joining us, for answering all that the questions. If we didn't get to your question, I apologize. We try to get through as many as possible and try to keep it as well-rounded as possible. So I know sometimes it's not possible to do all of them, but we appreciate you guys being here. Every month we do office hours where you get the opportunity to ask your questions to experts like Mary or some of our providers. Again, if you're not a Paloma Health member, go ahead and sign up for our membership. Just a reminder, your FSA benefits do expire soon, so you definitely want to utilize those before the end of the year. What's great about Paloma is that we accept FSA and HSA benefits. So for doctor visits, depending on the availability in your state, you can book an appointment. Our test kits are also FSA and HSA available, so you can order that as well with those credits. And then depending on your treatment plan as well, our supplement line can be covered depending on your doctor's treatment plan and medical requirements, I guess you can say, for your treatment. So again, thank you so much. Refer to our website for all of those blogs, resources. Go ahead and refer to our app. It's free. Tons of resources, workouts, meditations, all the things. We have recipes and everything that you could do, a whole AIP course if that's something you need to go through and kind of reduce that inflammation before the holidays as much as possible. And we'll see you next time, guys. Thank you so much for joining.
And happy holidays, everyone.
Yes, and happy holidays. Thanks, Mary.